Good morning. I can tell with the standing room only crowd here tonight, or today. Our topic today is the continually changing healthcare landscape for employers. It's probably the not only continually changing, daily changing. We are thrilled with the three panelists we have today, and we have, several of us have seen some of their material ahead of time, so I could spend last night trying to understand what they're going to tell us. Each of the panelists will take 15 minutes, and they'll go 1, 2, 3, and then we will have 10 minutes of Q&A. Their complete bios are in your package, so you can take a look. We also encourage you to take notes. There are notepad in your package too. And at the end, we think of you in many ways as part of our panel. And at the end, in that 10 minutes, we would like you to get up and ask questions or share a little bit of your own experience. And 10 minutes goes pretty fast, so, 3, 4 sentences, not 5 minutes. And with that, first we're going to hear from Mike Thompson, and he is the principal and head of PriceWaterhouseCooper's healthcare services practice. Mike is a national thought leader on health strategies, and he is a subject matter specialist on health reform. Mike?
Wow, never got a yay before. That's great. I like this crowd. When you think about health reform, 15 minutes doesn't quite do it justice, but that's okay. We're going to get there. We're going to do a flyover a roadway on what really every HR professional should know about health reform. I'm going to stay pretty high, but I'm also going to give what I see as kind of some key tips for people who are deep into health reform as well, some of the health and welfare professionals as well. So, I think no secret to this room, health reform is here, right? We've had a few things. We've just dipped our toes into health reform over the last few years. 2014 is the big year. So there's probably 3 things I'm going to highlight as the key issues. 2014 is when the public exchanges come into play. Guaranteed issue coverage, metal plans, meaning a bronze, silver, gold, platinum, essentially different levels of coverage standardized across the industry. That's all geared not to major employers, but to small employers and to individuals. Accompanying that is subsidies in those exchanges, up to 400% of the poverty level. For a family of 4, that can get into $92,000. That's a big number. A lot of people will be eligible for subsidies in the exchange. But beyond that, there will be an individual mandate. So if people don't have coverage, they're going to be bombarded with messages about, 1, you can get coverage in the exchange, whether or not they already have coverage, by the way. And secondly, they can if they don't get coverage, they're going to get penalized. The penalties are relatively small, but they don't know that. They won't advertise that the penalties are relatively small. So what do employers need to be really focused on? They have what they call a shared responsibility penalty, and that shared responsibility penalty essentially is a tax. It's an excise tax, a non-deductible excise tax. It's $2,000 times all of their full-time employees if they don't provide coverage to at least 95% of those full-time employees. And the definition, I'm sure we're going to hear more about that. That alone will keep you up at night trying to measure what counts as a full-time employee. If you do provide coverage to your full-time employees, and some of your employees don't get, quote, affordable coverage, costing less than 9.5% of their income, then you get penalized $3,000, but only for those employees who go in the exchange and get subsidies. So they have to actually meet the income limits, they have to not get affordable coverage, and then get in. Second big issue I'm going to bring up is, again, the PCORI fees and the reinsurance fees. There's a couple of big, essentially, taxes coming to hit employers. One's not so big, it's relative to the other one. It's $1 per employee per month this year, and then $2 in subsequent, not per month, per year. Subsequent years it's $2. But the other big fee is the reinsurance fee that's hitting not just insured employers, but also self-insured employers, $63 per head. That's a big number. That number will go down, is scheduled to go down in theory over the next few years, but that's essentially to help subsidize these public exchanges. So from a strategy standpoint, and then the third big thing to keep your mind on is the Cadillac plan tax. That's a tax for health plans that get over a certain threshold. That's a 40% excise tax that hits in 2018. Every major employer, particularly employers that offer rich coverage, are keeping an eye on, will I trigger that tax, and how do I manage my plan in the meantime? So what are the strategies that employers, 15 minutes isn't a long time. What are the strategies to kind of deal with that environment? Well, the first is deciding, you'll hear a lot about pay or play. We've kind of rethought that a little bit. First of all, it never makes sense, in my opinion, to not play. The bar is very low to avoid the $2,000 penalty, and the penalty is very high. 2,000 times all your full-time employees is very high. So the question isn't whether to pay or play. The question is how to play and when to pay. There are instances where employers may find it in their best interest and their employees' best interest not necessarily to provide, it's always in your best interest to provide coverage, maybe not great coverage, but some level of coverage. But it's sometimes in your best interest, not necessarily in their best interest, not to provide affordable coverage or not minimum coverage. And the reason is the subsidies in the exchanges are so great for people less than 200% of the federal poverty level. Essentially, they can get coverage for a premium that's lower than the premiums you will charge them if it's unaffordable. And secondly, the coverage gets enhanced for people below the 200% of the poverty level to look more like a platinum plan. 87 to 93% actuarial value, that's again better than the coverage you typically provide. So that's one of the issues. The first issue, how to play and when to pay. All right. Second big issue is then, of course, focusing on bending the cost curve. So what are employers doing? If anything, they're really accelerating some of the actions that they've been doing historically. We're seeing a big movement around consumerism, consumer-directed healthcare, high-deductible plans. Most people in this market have tiptoed in that market. They might offer a plan, whatever. We're seeing a much more aggressive action to moving more rapidly, potentially totally replacing towards a consumer-directed health plan, in part because those plans are best positioned to deal with a Cadillac plan tax when you get there in 2018. Because you can't simply cost shift premiums in 2018. That tax is all about the total cost of the program, including the employee's share. So that's the first strategy. The second big strategy is kind of the whole issue around population health, wellness, and all that. Frankly, a lot of people do a lot in that today, but don't get a big impact. There's the opportunity to kind of raise the bar there, improve accountability. There's the opportunity to raise the incentive limits as part of the bill. The third strategy is what I would call something that has been barely touched on by most employers, and that's what I would call a delivery strategy. We kind of shifted away from a delivery strategy back in the anti-managed care days, if you will. But I think there's going to be a reemergence of delivery as a core part of it. In fact, we have to worry about delivery because with all these new participants in the health system, we may find scarcity in terms of getting appointments and whatnot in the system itself. So in delivery, what does that mean? Well, you're going to see more on-site clinics, telehealth, aligning with provider systems on some sort of preferred basis, ACOs, patient-centered medical homes. So delivery, again, is entering into the equation. And frankly, I think that's going to get accelerated in part by the exchanges themselves because health plans are contracting now with more narrow networks, really trying to get a high-value network so that they can compete more effectively when they have to compete on an equal actuarial value. So those are kind of the three main bend-the-curves type strategies. Again, every company's a little bit different, but there is some convergence in that as a general trend. The other big trend that is out there right now is the issue of private exchanges. Every major consulting firm, not us, mind you, every major consulting firm has their own private exchange. And for retirees, that has been very, very popular. It's been emerging rapidly. Hundreds of companies are already participating in private exchanges for their retirees. For active employees, it's a newer phenomenon, but there are several major companies that have already moved in that direction, and the whole idea is to offer a series of prepackaged plans to your employees that are essentially created by this outside firm. It's kind of an extension of the outsourcing mode. They are available on both an insured and a self-insured basis, and they're not the same. When you actually go out and you look at these private exchanges, they have different value propositions. Frankly, I don't think the value proposition is as strong for actives as it is for retirees. I think it's a very strong proposition for retirees. But this is something that we're all getting bombarded with, and I think it's something that you need to keep your eye on. The idea of kind of shifting towards defined contribution over time. And then the final point I'm going to make, is compliance. You know, we've never really had as much focus on compliance in the healthcare arena like we have in the qualified plan arena. We know, though, that with all the regs that have been published, we're seeing much more orientation towards enforcement, and the degree of complexity that we're dealing with is unprecedented in healthcare. So with that, I'm going to kind of leave it there and let the next group go.
That's a man who's used to talking fast and getting to the point.